Welcome back to Better Health Tech, the podcast where we explore how technology is transforming patient care and the people behind it. I'm your host, Shelby Soto, and today we're diving into a topic that's moving fast, AI in healthcare. I'm joined by Dr. Marissa Gilbert, a board-certified medicine and neurocritical care physician. Dr. Gilbert has spent over a decade on the front lines where seconds matter and decisions can change outcomes instantly. Dr. Gilbert, thanks so much for being here.
Thanks so much for having me.
So you've worked in some of the most high-pressure environments in medicine. I'm curious how technology, even before AI, changed your day-to-day workflow.
Well, technology in the field of medicine is rapidly changing. I think, probably the surgical specialties see it the most with all the advancements made in certain fields like neurointerventionalism, where the devices used to retrieve clots are getting much better. So I think probably technology has played a big role in the surgical fields. In terms of like the medical side, prior to AI, I would say it didn't maybe for me play a huge role. In the ICU where I work, we do a lot of multimodal monitoring of patients, but the technology behind that, I think, has probably been around for some time. I think with AI, though, there's a huge change in the footprint of technology in healthcare, and it's rapidly transforming, I think, all aspects of medicine, not just in terms of like the gadgets and the devices, but the way that we obtain information, use that information. There's a lot.
So currently, are you using any kind of AI tools or implementing any AI tools?
I'm like so old school. It took me probably the longest to even start dictating with the microphone compared to my colleagues. But there are some things that I'm using. So there are apps that basically like a Chat GPT version, a medicine version for Chat GPT. It's called Open Evidence. I use that all the time. You just ask it a question and it'll synthesize information for you from all the journals that we use. That's probably one of the few things that I use, but I'm seeing people using it. I know radiology is using it for enhanced image detection skills, picking up on things that maybe they couldn't pick up without the use of AI to analyze their images. And then I know some of my colleagues are using apps to help them with documentation and basically to write their notes for them and for clinical decision-making tools. But I personally haven't started using any of that stuff yet. Not to say that I won't. But.
So it sounds like it's more of assisting instead of being the actual, if you're diagnosing something, it's just to kind of assist.
At this point, yeah.
Yeah. So it sounds like those are, tools that help assist but not make decisions. Are there any kind of rules or regulations with using AI in the ChatGPT version? If you are searching something for evidence, are there any kind of like protocols that they implement for physicians?
I think the most important thing is that everything is HIPAA compliant. I would say that's probably the biggest thing. Otherwise, as far as I know, no, or you're using at your own risk. And just like when you read anything in medicine, you're gonna read it with like a critical eye and not take everything as being truth or not, but it's just to help you.
So if there is one tool or system that you wish existed to help, better patient outcomes, what would that look like to you?
I think anything that could free us up more to actually do clinical medicine. So when it comes to like documenting, I think having something that maybe when I go see a patient, it records all the useful information of that patient interaction. And then when I go back to my desk, it's able to filter it into a note and a differential and even and orders. I think that would be really helpful. Anything that could just help the documentation and even searching within the medical record, things that take time. Um, I think that would be really useful.
Mhm. That sounds like a good opportunity for someone.
It does, doesn't it?
It does. Do you ever worry about AI in healthcare? Or are you
Like
more
taking over my
optimistic?
job?
Correct.
No, I don't. I'm not worried at all about that. You know, I would love to see family members yell at AI. They need that human. I think there's always a place for human interaction in medicine. I think that it's great and it's going to be very useful for patients and for physicians. But I think there's got to be, at least now, there's got to be a human interaction. There's just a lot of emotional components too to medicine, at least in the fields that I work in critical care and emergency medicine, where we deal with life and death all the time. Um, there's got to be at least someone there to guide the family through these tragic events that are happening.
That makes a lot of sense for the position you're in. Do you think, just in your opinion, that it can, that surgeons should be worried? Or do you think that there always has to be a human component to that as well?
I think right now, again, there's got to be a human component. You know, that is definitely something to think about down the line as these devices get more accurate. What role will humans really have? Um, I don't know. Are these devices going to be able to even advance the field of medicine themselves? Are they going to be able to create new ideas, or are there always going to need to be humans that are the creators and then creating these AI tools? But will AI tools be able to create better, newer AI tools? I'm not sure how that is going to play out in the future because I think if the answer is no, then you'll need humans to be driving the field forward.
Yeah, that makes a lot of sense. So, in your opinion, if you said a lot of things with charting, making things easier for you to almost working like as an assistant. Is there anything else that you think would help your day to day? I know you work really long hours, long shifts. Is there anything else in that would maybe cut your hours and those long shifts, or is there always that's just always going to be the role of a physician in their
Yeah, I don't think it'll ever change our shifts. I think if I have more free time, that doesn't mean I'll get to leave early. It'll just mean I'll have more free time to see more patients, I think.
Okay, that makes sense. Even freeing up charting.
Yeah, then I'll just get to see more patients.
Okay. Is there anything that can ever help that? Is there
More staff.
just more staff, more humans?
Mm-hmm.
Okay. Even for intakes, there's not. What if there was a robot or an AI tool that can do like an intake? If you can explain what an intake is to the audience, or maybe I'm not using the right words, but when you're in the pit, that's the first touch point with a patient, correct? So you're checking their vitals. You could explain all this more.
I mean, it would be amazing if there was a robot that actually was able to check all the vitals, do all the blood work, and send off all the labs. That would be amazing. Not to say that nurses aren't capable of doing that, but they can get overwhelmed when there's lots of patients and they're getting dragged in a million directions to patients requesting, water, blankets, family members having questions. If you have a robot that can just do the labs, sending them off, um, that would make things go a lot faster, that's for sure.
Yeah.
In the ER.
Yeah, that sounds like it would.
Mhm.
Sounds like it would have probably an impact on patients and healthcare as well.
Yeah.
Medical insurance and be more affordable. You never know if we can have
Well, anything
robots.
that could, increase the flow through the ER would be very helpful.
Yes. Well, thank you so much for your time today. I appreciate the conversation, and it was great having you here.
Anytime.
And thank you for listening to Better Health Tech. If you enjoyed this episode, be sure to follow and share it with somebody who's interested in the future of healthcare. See you next time.